What's going on, everyone? Today I want to go over your assignments for Unit 1 here. So aside from having your 2 knowledge check quizzes, you're going to have 3 things due this week: your Unit 1 discussion, a homework assignment, and then our practical application of our health risk assessments. First thing with the discussion here, pretty straightforward. For your initial post, what you're going to do is pick a chronic condition listed in Chapter 1, which we will go over, and is also in the Unit 1 materials. And then you're going to describe the risk factors associated with this, and then you're going to explain how and what kind of exercise you'll be able to use to help prevent and or treat this condition, and also make sure you cite your work. Even if you're just citing the PowerPoint or the book itself, make sure you cite your work there. And then you want to respond to someone else's post with a different condition other than yours, and say what any kind of precautions or modifications you would make to that. So pretty straightforward for the discussion. For the homework here, you are going to be doing an exercise in chronic disease and testing basics here, which is this one here. So a couple of things I wanted to point out. There are several different questions here, and it asks a few different things. So first one, why calibration is important, pretty self-explanatory there. Difference between reliability and validity. And then this here, fill in the chart below for both systolic and diastolic blood pressure responses to increasing exercise intensity. So at rest, you're going to have a low intensity. At exercise, you're going to increase the intensity. And recovery, you will decrease. So the intensity should be a bell-shaped curve. Now, you need to draw 2 lines representing systolic and diastolic blood pressure. The way you can do that is go to Insert, Shapes, and click on this little squiggly line here that says Freeform Scribble, and that will allow you to draw your line. Once you get that, you want to go to the Shape Styles, click on the More, and you want to click on the thicker box there. Make sure one of them is blue. Go back to Insert, Shapes, again, click the Freeform Scribble, and you can go again here. Go for again that thick line, and make sure one of those lines is red. So you should have one blue line, one red line. The blue line represents your diastolic blood pressure. The red line represents your systolic blood pressure. For the bottom here, you are going to label each segment of the ECG printout here. You only need 1 heartbeat, so meaning you only need to do 1 of these here. So I would just pick this first one. It's perfectly fine to label what each segment represents, and then you want to write about what each of those are going to mean. Calculate the heart rate from this here, and we'll do that based on, we'll tell you how to do that in class. And then 1 to 2 sentences, explain what in the body is affected by each of these chronic diseases below, and then how is this then affected by regular exercise. So you want to say, what does, for example, CAD or coronary artery disease do to your body, and then what does regular exercise do to then treat that. Make sure you include your references below. It doesn't have to be perfect APA formatting, but make sure you include your references. So that is your assignment there. And then for the practical application here, you're going to be doing this health risk assessment here based on the Farmington lifestyle application scale here. So you have several different scenarios. I'm actually going to walk through the first one with you here. So you have these 6 boxes to fill in, your point totals. So you're actually not filling in the anything for these top 2, I should say. So just for these bottom 4. So the LDL and the cholesterol totals, you should have points here. For the risk percentage, you should have a percentage number there. And then lifestyle changes, you're going to actually write lifestyle changes that each person can make to improve their overall coronary heart disease risk or chronic heart disease risk. The scales you need are at the bottom here. So figure 1 is your risk stratification guidelines for males. Figure 2 is your risk stratification guidelines for females. And let's look at everything you need here. So there are 6 different things you need to know. You need to know their age, their LDL cholesterol, their total cholesterol, their HDL cholesterol, their blood pressure, if they have diabetes, and if they're a smoker. If we go back to our first scenario here, we have a 45-year-old male named Carlos. So the first thing you want to make sure is that you are noting he is 45 and a male. He smokes a pack a day. His blood pressure is 135/85. Total cholesterol is 340. HDL is 23. He has a family history of all this, but it doesn't have any of that himself. So if I go back down to figure 1, and I look at all the information I have here, he is 45 years old, so that is right there. And I'm just going to make a quick snippet here so that I can write on this a little easier. Alright, so he's 45 years old. That puts him right here. So you want to have two columns here, LDL and then cholesterol. Oops. Alright, so for age at 45, the LDL points he gets are 2. The HDL, or the total cholesterol points he gets, are also 2. I'm going to skip LDL right now. HDL, we said he has 23. So for his HDL cholesterol at 23, since that is less than 35, he gets 2 points for each of those. For his total cholesterol, he was at 340. So total, since that is above 280, he gets 3 points for his total cholesterol. Notice you only have one choice for total cholesterol, one choice for LDL, so you only fill out LDL on one side, cholesterol on the other. Blood pressure, 135/85, so we go down to the blood pressure. He is at 135 here over 85, so that gives him 1 point on each. He does not have diabetes, so he gets 0 points there. He is a smoker, so he gets 2 points there. And then how we calculate his LDL cholesterol, well, all you're doing is you're taking his total minus his HDL, and that will equal LDL. So 340 minus 23 is 317. So at 317 for his LDL, that is above 190, so he gets 2 points there. So his LDL total is 24689 points. His cholesterol total is 2578910 points. If I then go over to my risk factors here, so his LDL points total was 9. His 10-year heart disease risk is 22%. And his total cholesterol score was 10. That gives him a 25% risk. And at age 45, if you look at the comparative risk, so he is at a higher risk overall than anyone else in his age, or than an average person in his age. So what I'll do is I will go back here and I will include in his points total the LDL total, which was 9, the cholesterol total, which was 10, the LDL percent total, which was 22, and the total, which was 25. And then I would write here 3 to 5 sentences about how he would make changes to improve on the status here. So that is your assignments for the week, and then I will see you all later.